Hi, it's Dr. Evelyn here at Eudaimonia Chiropractic, and today I want to talk about using hip hooks or claws or very targeted myofascial release techniques and what some of the considerations that you should have before using any of these very targeted tools. One thing we really need to consider is that our fascia is a contiguous tissue. There are no different pieces of fascia, like we have different muscles that we can identify and name. We have regions of fascia that we talk about, like the thoracolumbar fascia or the plantar fascia or things like that. But in reality, that fascia is connected to all of the other fascia in the body. So when we're working on the system, we need to be working on the whole system and we need to be considering the entire system. So working on certain areas of fascia in isolation just tends to be less effective at best and can also be harmful at worst because we don't know the effects that our release is having further up the line or further up the kinetic chain. So it's really important to work with somebody who knows how these fascial lines are connected and also understands what that release would do to your body. That leads me to my second point. Fascia has a protective mechanism to it. So it does in fact get triggered by stress and load and also alarm in our nervous system to come in and tighten and sort of shrink wrap and brace. So if we have an area of our system that is really tight and chronically so and hard to release, we really want to understand why our body did that in the first place. It's fair to say that our nervous system can go into full alarm mode and then isn't really always the best at getting unstuck. So that's when releasing fascia can be helpful. But if our system is still in alarm mode and we are still needing that bracing and we go in and we try to release it, that is going to feel very threatening to our nervous system. So we want to make absolute sure that our system is ready to receive and ready to open up to any releases that we're wanting to do, because we don't want to take away the brace if something is really injured or needs that support, right? You wouldn't take crutches away from someone with a broken ankle. That doesn't help them, right? So we don't want to come in and just attack certain muscle groups like our psoas with a hip hook or something like that, when that psoas fascia is coming in to stabilize and support for some other thing going on in the system, or because our nervous system is in alarm and created a bracing that we haven't yet addressed, right? That only would add stress to the body. So that being said, these are tools that can be very useful when they are being used in a plan, in a way of caring for your body holistically, especially when you look at some of my other videos about dynamic fascia release and approaching the fascia with the nervous system first mentality. Once you get some of those things moving, you start moving dynamically and you're kind of following along with this, and then you know, it's just time to get into our psoas a bit, but we're having trouble with the foam roller or things like that, and we can utilize a hip hook in order to do that. But if you're having hip discomfort and you think that just getting a hip hook in there is going to be the thing that makes all the difference, you could actually be doing a little bit more harm than good, and also creating patterns and creating dysfunction. You're basically playing whack-a-mole at that point, where you're just moving the dysfunction somewhere else up the kinetic chain. And obviously that's not what we want. If you have noticed or have experience with hip hooks and things like that you want to discuss in the comments, I'm always very happy to hear your comments on these videos. Let me know if there's anything else that you would love me to answer for you here on this channel. I'm glad you're here. All right, take care. Bye.